Karen Bambo, I would just like to clarify, no? In some studies kasi, infiltration and extravasation are interchangeably used.
Just like in one study of mga surgeons, they collected yung information from this patient, referred to them sa plastic surgeons, and i-mention niya nga na they usually use it interchangeably, but in actuality talaga, you should separate it. It should be infiltration for non-vesicant and extravasation for vesicant na agent. No, pero more or less sasabihin sa'yo nire-refer kasi nag-infiltrate, ganun, generalized, but should technically there should be a difference and actually distinction, and iba kasi yung approach that you should give and management and yung urgency, especially kung if it's a vesicant, automatically it's a grade 4 injury. So yung management would be different as well.
Another question for you, Dr. Bambo. Is it advisable to use central line to minimize risk of infiltration for pedia patients undergoing prolonged IV fluid therapy?
Especially for patients in the pediatric ICU, we usually advise, or it's preferred, especially if you have a lot of drips aside from the IV and medications, and if you are expecting that this patient would have a longer hospital stay, and especially if we are using drugs that are more or less concentrated, and we need to titrate the volume for this patient, especially kung cardiac patient. But again, the table I showed earlier wherein we mentioned yung high risk, intermediate risk, and low risk na mga drugs, it doesn't mean na at all times parang encourage natin lahat yan is central line, but we also have to weigh the consequence of having a central line or yung disadvantage like thrombosis, infection. We should weigh the risk against the benefit. And also, it only emphasizes na dapat with this kind of agents, high-risk agents, then we should increase yung peripheral IV monitoring of our bedside nurses. And also, number 2, as doctors should be clear on our prescription of the medications that we are asking the nurses to run, diba, to the IV. So yung concentration, we should be clear with that. So it's working hand in hand, and also weigh the risk against the benefit. We should also remember na yung mga low risk doesn't mean na it's 100% safe. Again, walang 100% safe, even simple isotonic solution in large volume and if with large pressure with automated na machine can cause compartment syndrome.
Right. And a reminder given to us by Dr. Uy is the best practice is to remind staff to aspirate frequently if the IV has a backflow, then gently push the drug.
world moves in real time. So should our healthcare technology. With information needed, decisions to make, and experience to share, every second counts. Live integrated tele-ultrasound enables real-time communication, remote collaboration, confidence, knowledge, and learning. The first ever integrated tele-ultrasound collaborative platform. Philips Lumify. Integrated tele-ultrasound powered by React's collaborative platform. Innovation and you. Philips.
Have you come across some studies, because there are questions here about glutathione, aloe vera, or honey for wounds from extravasation or infiltration?
Actually, yung
Glutathione.
aloe vera parang wala akong nakita, no? But I came across parang title abstract lang of honey ang nakita ko. For neonates yung nakita ko na with a promising result. Although I wasn't able to read the whole article, but it mentioned the benefit of parang honey on extravasation in neonates. Pero the glutathione, I haven't came across those studies pa.
We're gonna wrap this up, and would you like to have any last or take-home messages for our viewers? Dr. Bambo, then Dr. Evangelista.
Okay, so I think the most important thing is for IV in infiltration and extravasation is prevention again. So I would like to emphasize the TLC, touch. You have to touch the patient, you have to look and compare the extremities of the patient at all times. So monitoring, reassess every now and then if there's formation of any signs of these injuries.
So judicious fluid use, it's very, very important. Remember that IV fluids, they are also like drugs. They have side effects. They should have indications. They should have contraindications, and they should be monitored. Also remember that when you hydrate, you don't just use IV hydration. You can use oral hydration. So if you can transition your patient from an IV to oral, then that's the best way to go.
Thank you again, Dr. Karen Bambo and Dr. Paula Pilar Evangelista, for sharing your invaluable knowledge in this lecture. And to our viewers, thank you for joining us. We hope you enjoyed learning.